Thank you very much to the European Commissioner, Stella Kyriakides, who joined us and opened the path for the future. She also stressed the importance of having this European Union and left a positive note on what Portugal has been doing in terms of digital health. I will now call on to the stage the Deputy Secretary of State and for Health, António Lacerda, with whom we will wrap up this first day of the eHealth Summit 2021. Good afternoon and welcome. Please take a seat and thank you for being here with us. And thank you for talking to us about a subject as important as digital health. Or this last year, because of the pandemic, it has gained huge significance. And first of all, I'd like to ask you, what impact has digital had, and how can it contribute to improve health? First of all, allow me to thank SPMS for the invitation to be here today. It is a crucial body, fundamental body of the Ministry of Health that has undertaken amazing work, and I'd like to thank the chair and to acknowledge what has been going on, Luís Góes Pinheiro. I'm a healthcare professional, and healthcare professionals look at digital transition from a consumer perspective. Also, in terms of streamlining processes, of course, yes. As doctors and nurses, anything that uses the systems needs to have or wants to have streamlined systems. And this has been happening. It has been improving. I was just telling someone outside that I worked with my mobile system. And I see that what we've evolved so fast. The number of platforms that have turned up since last year, Trace, RSC, the Live, all the platforms we know. So it's been an extraordinary evolution over this last year. We benefited from this, from both this challenge and opportunity that the pandemic gave us. But I think it is very important to continue to, as the Commissioner just said, maintain our patients at the core of our system. And for us, healthcare professionals, it is remarkably important to have this evolution, but allow me to just make note of a small detail. Patients need us to touch them. Human touch is important. I'd say that it's two very important dimensions: human contact, human touch, in person, and digital. And I think that it is in the convergence between what is human, what is digital, that is where we will find a lot of the solutions for our patients. So they need to be complementary. That is one of the messages that has been left here today. How can digital transition bring value to health? Well, exactly on this basis of creating more value for the patient. That is the only explanation. But I'd also say that from a transnational perspective or a transborder perspective, as we saw, the virus sees no borders. It sees no time zones. Digital doesn't have any borders either, but time zones, well, maybe not, but we'll see. But it is a bit closer to this need of what we have in terms of transborder needs, as the Commissioner also pointed out, that we need to have interoperability beyond our borders among the various European systems. And during the Portuguese presidency, we have led this path very well, as was also noted. We've led this process of gains in health. It is a transborder, transnational process. What are the main challenges post-pandemic in the field of health, and how can technology be an ally to respond to these challenges? Well, I think that the challenges will continue to be, well, we will have other pandemics. We are almost 8 billion. There will be other pandemics, and we need to be prepared. And today we have tools that we didn't have a year ago. The digital transition allowed us to help us, and this is essential for another pandemic. But then there is another important tool for what was left behind because of our focus on the pandemic. And what was left behind was what was scheduled. The diseases that, for reasons we all know, weren't treated either for fear of the patients or lack of capability sometimes, or because there was no proximity. So a lot of disease were left behind, and we need to recover this. We are making huge efforts for this in the first quarter. As we know, we recover this because of the online consultations. We recovered many consultations in primary healthcare. We had more consultations than in the previous period in hospital context, more than 400,000, and we had 32,000 surgeries. So we are optimistic, we are confident for the near future, because in March and April, in regard to similar years, we turned this quarter into a very important, it's very important in terms of what we need to do, and digital transition was essential. Can we claim that we are at a stage of recovery despite the pandemic still being present? Can we believe in this perspective of recovery? I would like to leave this message of optimism and confidence, because that is what we're doing. That is why we're investing. From a structural perspective, from a financial perspective, from a human resources perspective. But for that, we need these tools that were created, new tools, these new platforms that now exist, and healthcare professionals will certainly use them in the future. Today, we've spoken a lot about citizens, how platforms, how responses have tried to meet citizens' needs. There is another word that is being mentioned over the day for healthcare professionals. What message would you like to leave for healthcare professionals who have tried to rise up to the challenge of all these technological challenges? Make the most of this opportunity. I am sure they will. Healthcare professionals, we have this whole new generation coming in, and it is a tech-driven generation that will surely use this opportunity. And they were the ones, I know this is cliche, but it's true. They were the ones on the front line, and they will know how to make the most of this opportunity. But I would like also to leave a brief word to the most vulnerable brackets of our society, the ones that supposedly are the ones more digitally excluded because of the digital divide. I think that it is the convergence between these two that patients will need to, healthcare professionals need to grab this. They're having cooperation with other countries, training, cooperation, being in touch with their patients, even the ones that are most excluded. I think that it is by converging these realities that we will make a future. That is what we are discussing. This was the first day. Tomorrow we'll be discussing the main subjects in digital healthcare. So what importance do you give to initiatives such as this one that combine experience and knowledge and are a space for change, for exchange? I think that all of this is fundamental. Everything we spoke about today is a fundamental lever for us to be able to influence others, to build and spread the message with the help of the media. So I think that these types of initiative that I would like to congratulate once again SPMS and the board of directors. I'd like to say that this is fundamental for us to reach further and for the digital world to be an increasingly used tool. Thank you very much. I will now ask you to close or wrap up this first day officially, this first day of the eHealth Summit 2021. Thank you very much, and I'll see you soon. Thank you. Good afternoon, everybody. I will begin by greeting the chair of the Shared Services, Mr. Luís Goiás Pinheiro, and the remaining board. Thank you very much for your invitation. Thank you very much for all your work, and congratulations for all your hard work. It is a huge pleasure for me to be here today to wrap up the first day of the eHealth Summit organized by the Ministry of Health Shared Services together with the Ministry of Health and the Portuguese presidency of the European Union. This technological summit gives us the opportunity to forecast the future of our country by having an integrated reflection on the various challenges with regard to technological advances in the field of healthcare. This forecast or outlook naturally reflects on the last 15 months since the pandemic started in Portugal. Although Portugal had already started this path to digital transition before the pandemic, this health emergency had a catalyzing effect on the need to implement products and services. Innovation and streamlining networks and information systems in health are today the day-to-day running of the NHS, to which SPMS and the Ministry of Health, through several instruments, have contributed in a determining way to make the NHS more capable, more efficient, and closer to citizens. That is why we are really pleased and confident that innovation fostered by science has kept abreast of the urgency of the moment we are all now experiencing, ensuring the necessary responses and having optimism in terms of our collective future. Today, tools, platforms, digital platforms, and telehealth instruments were at the core of the discussion. These were developed to respond to the major challenges the NHS has faced. And I underline, the NHS has been able to respond to them. It has shown its preparedness. The adoption and implementation of digital has contributed to effectively improve access to healthcare, mitigating inequalities, and reducing geographical distances. The impacts of the digital transformation have been profound, whether through artificial intelligence, telemedicine, telehealth, a rise in the number of consultations in the NHS in real time, and among many, I will highlight the NHS Live platform for online consultations, the helpline NHS 24, the digital vaccine bulletin, Trace COVID, scheduling the vaccination platform, telemonitoring patients, the reinforcement of existing infrastructure like CNAP. That is just a few of the examples I could give you. And we did all this to make sure that no one is left behind, improving access to healthcare, avoiding bottlenecks, enhancing the dialogue and trust between physician and patient. The last few months fighting the pandemic, we've had digital advances in healthcare that have had maintained safety, resilience of our health system for our citizens. Today, we strengthen our conviction that innovation and the technological capabilities of the NHS are crucial to health and support the work by professionals. They contribute to reduce pressure on the hospital services and are solutions for citizens who, at a distance, can obtain a diagnosis, a referral, have an online consultation, and many times will have their problem solved. But allow me once again to make a comment on complementarity. These online consultations are a great complementary means to consultations in person. They should act as a complement. The government, during the Portuguese presidency of the European Union, has contributed greatly so that by the 1st of July, we will have the COVID-19 digital certificate live, so that we can have the necessary confidence and safety so that there can be free circulation within the European Union, and so that other citizens from third countries can come, other countries can come into our country. We know that we need to continue to invest in modernizing the technological infrastructure of the NHS. It is fundamental to obtain more and better data, the purpose of reusing them more and better, collecting them, storing them, and reusing them will improve the capacity of the NHS for surveillance in public health. We are also aware that the enlargement of these services to the various levels of the NHS is still a challenge. We need to make sure that the implementation of digital tools adds value to people's life and health, ensuring the principles of humanization, quality, and safety in healthcare. The success of the implementation of digital health tools is associated to technological prerequisites, more literacy in health, and the decentralization of healthcare outside the health units. An example of this is NHS 24 counters. This will only be possible if, at the same time, we try to fight this digital divide and promote health literacy. Given the subject of the summit, we need to have all the resources available to fight, as I said, digital divide and promote digital literacy. This is the time to look at the future. And to speak about the future in health is to speak about digital transformation in health. Over its history, the NHS has proven that it has the capability to reinvent and transform itself. So we need to put the citizen at the core of the system, fostering more engagement in preventing, monitoring its health, as well as managing any disease. In this sense, allow me to recall also the Recovery and Resilience Plan that envisages investing in the digital transition of healthcare 300 million euros. It is to improve the quality of health services and the resilience of the IT systems available, to streamline, uniformize communication channels between the patients and the healthcare professionals, ensuring mobility and usability as well as medical records, to standardize critical data, to identify anything that is needed within the structure. We are certain that these instruments and others will be decisive to turn the NHS into one that is more modern, more appealing, more efficient, ensuring the necessary response to all those who seek it out. We have huge challenges ahead of us. We want to continue to invest in modernizing the technological infrastructure of our NHS, as well as digital literacy and health literacy of the population, contributing to a more resilient NHS that is more inclusive, fairer, more efficient, and also closer to people. Thank you very much.